For my site visit, I went to Hand and Orthopedic Physical Therapy Associates. This place is located in East Windsor, New Jersey. Two physical therapists that I met were Douglas Armstrong and Shane Harris. Douglas Armstrong graduated from Thomas Jefferson University in physical therapy and specializes in hand therapy. Shane Harris is who I went to Hand and Orthopedic Physical Therapy to actually shadow. He went to Arcadia University for grad school and graduated there back in 2015 with his doctorate of physical therapy. He interned at Hand and Orthopedic Physical Therapy back in 2016, and after his internship, started working there. Some questions that I asked were, how did you know you wanted to be a physical therapist? And what aspects of physical therapy do you enjoy most? And what do you find challenging for you? Reasons he wanted to be a PT were because of his dad, because his dad wanted him to do physical therapy because when he was younger, he had a temporal mandibular joint surgery, so he actually had to go through physical therapy. And for him specifically, his love for anatomy and him wanting to actually do something in that type of field. Some things that he enjoys about physical therapy is learning from his patients. Some people actually really surprise him with how motivated they are and how well they push through their emotional and physical boundaries of their injuries. Every person he treats has a special story to tell, so he actually gets to learn something new and valuable from each person every single day. Some things that he finds challenging is paperwork because of how tedious and a time killer it can be, and sometimes working with the patients because it seems as if they don't wish or appear to actually want to improve their conditions, and some patients are just trying to exaggerate their condition to not have to work. What types of training did you do leading up to employment? He did inpatient and outpatient in different types of settings, so like hospitals, in clinics. And he also did internships, but they were mostly during grad school. What are your daily duties and what type of patients do you see? Some of his daily duties were to evaluate new patients, so talk about their diagnosis, their prognosis, the anatomy of their body, and demonstrate different types of exercises, and he'll relatively see about 12 patients a day. Some types of patients that he sees are orthopedic, neuromuscular, adolescents, people that need physical therapy on their hands, geriatrics, occasionally pediatrics, and then people that have been in auto accidents, workman's comp, and worker hardening. What type of relationship do you have with your patients? He tells everyone to call him by his first name because it puts them more on a personal level, even though he does have his doctorate. He asks about their preferred name, and he likes to be on that personal level, so it gives his patients more comfort and it makes the rehab experience more pleasurable. I was allowed to take some pictures, so some pictures that I have is starting from left to right. We have the tables that they have for hand therapy, a BTE stimulator, which this actually helps replicate hundreds of real-world jobs and daily living functions. Then we have an ultrasound. I have a picture of what one exam room looked like, and then there's a station for different types of splints that they can make for their patients. What advice would you give students entering the field, and what do you think that they look for when hiring an employee? Some advice that he gave was to get out of your comfort zone as much as you can. For grades and GRE, to keep them high, but while doing that, to do extracurricular activities because that helps with your resume. Know your anatomy well. Shadow many different settings, including inpatient, outpatient, ICU, neuro, cardiac. And for grad school, to practice everything that you learn. And when it comes to hiring, this is what he personally feels, and is to be well-rounded, smart, personable, and make sure that you're evidence-based. What qualities do you feel one must demonstrate to be successful in the field? One must demonstrate these qualities, and he also feels these personally. So confidence, passionate, healthy, intelligent, smart, diligent, disciplined, and to be punctual. So overall, from my experience, this was huge for me because this was my first step into seeing what physical therapy was like and what a day would entail. What was even better about this experience was that it was a very welcoming environment, and I was actually told at the end of it to come back and to keep observing and to keep asking questions at any point, and he would be freeing to keep giving me like different answers and like different routes to go. However, I'm still not 100% set on a career path, but this was definitely a great step forward. Overall, I'm glad I got to have this experience because I was able to visit a site of my choice and get to interview and shadow a physical therapist, and it really sparked my interest in the field even more.